Hi, my name is Danielle, and today I'm going to be demonstrating the IV Piggyback. So first I'm going to make sure I have all my supplies. I have alcohol swabs, I have a 3 to 5 ml flush, I have my hook to hang my primary, got my secondary med, I have my secondary IV tubing, gloves, and hand sanitizer. So the first thing you want to do is make sure that you check with the physician's order and the patient's medical administration record. You want to make sure that you have the correct medication, that you're giving it the correct route, the correct dose. You want to make sure you have the correct vehicle solution type that's inside the piggyback. You want to check for the clarity. You want to see if it's cloudy, that would mean that the med is mixed in. You want to just make sure you know what you're giving. You want to know the safe dose range, any clinical implications, age-specific considerations. You want to make sure that you check the expiration date, make sure it's not expired, that there's no leaks, it hasn't been opened, that it's new. You want to make sure that you label with a patient ID label. You want to have the patient's name, medical record number, the date and time you're going to be hanging it, the medication name, the dose, and the route you're giving it, and as well as my initials since I will be giving the medication. So once we have established we have the correct med, we have all our supplies, we have checked everything, we know the final max concentration, the safe dose range, the dose we're giving it, and the rate and volume, we can go ahead and go into the patient's room. So go ahead and introduce yourself. Hi, my name is Danielle, I'm a student nurse, and today I'm going to be hanging your medication today. So you want to do 2 patient identifiers, check with the ID band, or if the patient's old enough, you can ask them questions. You want to check the name, the birth date, the medical record number. You at least need to verify 2. You also want to assess for any allergies, so check the ID band, or you can make sure that you check the chart before coming into the room. You also want to do any assessments for the med, so if you're giving a respiratory med, you check the respiratory rate. If you're giving a cardiac med, you check the heart rate, blood pressure, things like that. So now that we've checked everything, we can go ahead and come over here. So we're going to rest that down for a moment. Wash our hands. So we want to make sure that everything is stopped, none of it's connected to the patient, nothing's working right now. So we're just going to set up. We want this hanging lower than the med we're going to be giving. So we're going to place this over here. Okay. And we're going to be placing it in the 3rd port, or the port closest to the IV bag. Okay. So we're going to go ahead and get our brand new tubing, and we're going to go ahead and spike the bag. Okay. Make sure that this is clamped so nothing leaks out when we hang it up. We're going to hang it. Take an alcohol swab. Go ahead and swab for 15 to 20 seconds. So once again, everything is clamped right now. We're going to go back to the patient and make sure we wash our hands again. We're going to put on some gloves. And we're going to want to make sure that we assess the IV site. You want to see if it's infiltrated, if there's any signs of phlebitis, any redness, pain, or anything. And you want to make sure you check the patency of the IV before beginning the med. So once again, we're going to swab 15-20 seconds.
Where's the bone? It will go in the bone? Because like what you did, you were there.
We're going to take our flesh, attach.
No, I didn't actually like
Okay, we're going to unclamp. Then we're going to do push pause, 3 to 5 mils. Make sure that it's patent. If it's not, you would stop and call the doctor. Okay, so that's right. attach it to the patient. If it was hanging like this, we want to make sure that this was capped, otherwise we'd have to get new tubing because it would be contaminated. So again, we're going to need to alcohol swab. We're going to go ahead and disconnect. Alcohol swab, 15-20 seconds.
I need a pack for these injections. Okay, Gab's go, so make it come on.
Now we can go ahead and attach. Okay, so everything's still clamped, it's attached. So now we're going to come back and prime this. You can prime it before you come into the room by just having the med fill up through the tubing, but you risk losing medication that way. So another way you can do it is you can back prime. So you just want to make sure that you hold the bag lower. Open this clamp first. Make sure that it's flowing. We're going to back prime it. You can see it's filling the drip chamber. You also want to make sure that there's no bubbles in the line, so you can let it flow until the bubbles are out and filling up part of the drip chamber. Okay, so now we're about halfway. So we want to clamp again. We're going to hang. Okay, so now we're going to go ahead and program. So the primary is already set up. So we're going to come to the machine. We're going to press piggyback. And we're going to see how much volume is in here. So there's about 50 mils, and we need to include a flush, which would be 20. So the volume to be infused is 70. So we're giving 70 mils. And if the order says it's to be given over 30 minutes, we would double it. So it's going to be a rate of 140. So that's what it says, rate 140 mils an hour, volume is 70 mils, so we're going to have 50 mils of the medication given in 30 minutes, including the flush. So now that we have all that set up, we want to make sure, check all our lines are open, open the one on the patient, open this clamp, and then you can go ahead and hit start. And you'll begin to see drips.
No, she did, but then she went back and said, well, no, because...
There you go, starting the drip. And then once you're done, you can come back in when it's finished, assess the patient, disconnect everything, and you're good to go.
But then she went around.